I think access to mental health services, especially in the realm of, using technology to our advantage with mental health and the barriers that come with insurance companies. I feel like when people think about mental health, they instantly think, okay, like, does my insurance cover this? And as I had mentioned earlier, when the pandemic happened, there was a lot of pushback from insurance companies. There was a lot of barriers. And I I just remember these horror stories from providers who were on insurance panels and they're like, "I can't meet with my person and we're in the middle of a pandemic right now."
Hmm.
So I think the idea of like affordable mental health care and accessible mental health care is not being talked about, and it absolutely needs to be.
What do you think can be done to increase access?
So from the insurance companies, like paying their mental health providers a decent reimbursement rate. I know personally that's why I never accepted insurance. Like mental health providers go through all of these years of training. We have student loans, and yes, that's not the problem of the people that we see, but in order to provide services, in order to prevent burnout and pay our bills, like we need to get paid a decent wage. So I think people expect like the rates that they see out there are exactly what mental health providers get reimbursed from the insurance company. And that's actually not true at
Mm,
all. So the low reimbursement rates then cause mental health providers to now see 40 people a week, which is not ethical. It's not sustainable and it's going to cause burnout. And now you have your mental health provider in a mental health crisis.
yeah. No, that's not good. And that's interesting because you would think the insurance companies would have a financial interest in decreasing those long-term costs. And there's lots of data that shows that mental health, especially for early childhood, those was it adverse childhood events?
Mhm.
Yeah, ACE can lead to all kinds of
Yeah.
issues further on. So I'm curious if you have any thoughts on this. But why do you think it is that it's not obvious to them to change the payment practices?
I think there's probably, there's something it doesn't work for their interest. It's
Hmm.
not in their best interest as the insurance company. If people stay in network with the insurance companies can then dictate to the mental health provider on how many sessions they will
Yeah.
allow, how much they're going to reimburse the provider, what diagnoses they're going to reimburse for. And like there's people making these decisions that, they'll look at a diagnosis and say, "Nah, we don't like this one." Well,
Hmm.
okay, that's what the person has. So what do you mean you're not going to reimburse for this? So I think the insurance companies like control, and it's a way to keep those who are paneled with them under their thumb, unfortunately.
Hmm. Well, hopefully that changes. I know there are a lot of interesting companies that are taking venture funding and whatnot to try to break it up and see. So that's kind of on the business model and financial side. You mentioned technology as well. Any thoughts around how technology can make better mental health care more accessible?
Definitely. Again, like I keep going back to the pandemic, but it's so fresh and it's such a good example of, I'm in New Jersey physically. So when New Jersey went into the stay-at-home order, yes, technically as a mental health provider, I could still see people in person. People didn't want to be seen in person. So it was like, okay, like what do you want to do? And I had some people stop sessions because they were like, oh, this is only going to be a couple weeks. It's no big deal. And then 2 months into it, I'm like, "What do you wanna do? You haven't been seen for 2 months, and there's no end in sight." So, technology allowed people to still get the mental health treatment that they wanted, that they needed, and there's tons of research that shows that it's just as effective as in person.
So more support for remote therapy.
Absolutely. More support for remote. People who even outside of the pandemic, like people who might be homebound for various reasons,
Hmm.
like now they have access to mental health providers, or people who live in small communities who maybe don't have access to mental health in those communities can now just hop on a phone call, a video chat, whatever it is, and see somebody now.